The numbers are stark. They tell a story of two Americas. In one, HIV rates are steadily declining, a testament to scientific advancements and public health efforts. In the other, a crisis rages on. This is the reality for Black America. Black Americans make up only 12% of the US population. Yet we account for 40% of new HIV infections. This is not a coincidence. This is a crisis born of systemic neglect and deeply rooted inequalities. We are dying at a disproportionate rate, our bodies bearing the brunt of a disease that should not discriminate, but always seems to find us. The American dream feels more like a cruel illusion when you look at these statistics. We are told that hard work and perseverance will lead to success. But what about the countless Black lives ravaged by HIV, robbed of their futures before they even had a chance to dream? This is not just a health crisis, it's a social justice issue. We must confront the uncomfortable truths about race, poverty, and access to healthcare in this country. We must demand better. We must demand justice. Why are Black communities disproportionately affected by HIV? The answer lies in the intricate web of social determinants of health. These are the conditions in which we live, learn, work, and play. They shape our health outcomes in profound ways. Poverty casts a long shadow over many Black communities. Limited access to quality healthcare, housing instability, and food insecurity all increase vulnerability to HIV. Lack of health insurance and high costs of care create barriers to testing, treatment, and prevention. Stigma and discrimination compound these challenges. Fear, silence, and shame prevent individuals from seeking help and disclosing their status. This fuels the epidemic, making it harder to reach those most in need. We can't talk about HIV without talking about the criminal justice system. Mass incarceration disproportionately impacts Black communities, disrupting social networks and creating pathways for HIV transmission. The weight of these inequalities is heavy. It's a burden carried by generations, passed down from parent to child. We cannot ignore these realities any longer. We must address the root causes of this crisis, not just the symptoms. Behind the statistics are real people. Mothers, fathers, sons, daughters, friends, and lovers, all living with the realities of HIV. Their stories are not just statistics. They are testaments to the human cost of this epidemic. Take, for example, Miss Jackson, a grandmother raising her two grandchildren after their parents succumbed to AIDS-related illnesses. She navigates a complex web of social services, struggling to make ends meet while battling her own health challenges. There's also Marcus, a young man diagnosed with HIV in his early 20s. He faces stigma and discrimination daily, battling not only the virus but also the ignorance and fear that surround it. Yet he remains a beacon of hope, advocating for greater awareness and access to care in his community. These stories are not isolated incidents. They represent the countless lives touched by HIV in Black America, stories of resilience, strength, and unwavering love in the face of adversity, but also stories of loss, grief, and anger at a system that has failed so many. We must listen to these stories. We must amplify their voices, for in their experiences we find the urgency for action, the imperative for change. Section 4. Bridging the gap towards equitable healthcare and community support. Ending the HIV epidemic in Black America demands a multi-pronged approach. We need bold solutions that address both the individual and systemic factors driving this crisis. Expanding access to quality, affordable healthcare is paramount. This includes ensuring universal healthcare coverage, reducing the cost of medications, and investing in community health centers. We must prioritize comprehensive HIV prevention strategies. This means increasing access to condoms, expanding PrEP, pre-exposure prophylaxis utilization, and promoting harm reduction practices. Addressing the social determinants of health is crucial. We need investments in affordable housing, quality education, job training programs, and economic empowerment initiatives. Combating stigma and discrimination is essential. We must promote open dialogue, educate healthcare providers on cultural sensitivity, and challenge discriminatory policies that perpetuate inequalities. This is not just the responsibility of government, it requires a collective effort. We need community-based organizations working on the ground, researchers developing innovative solutions, and advocates demanding change. Section 5. A call to action, ending the HIV epidemic for all. The fight against HIV is far from over. It's a fight for health equity, for social justice, for the fundamental right to live a healthy and fulfilling life. It's a fight we must win. We can no longer afford to stand on the sidelines while this epidemic continues to devastate our communities. We need everyone to join this fight. Educate yourself and others about HIV, challenge stigma and discrimination wherever you see it. Support organizations working to end the epidemic. Advocate for policies that promote health equity. This is not just about HIV, it's about creating a more just and equitable society for all. It's about recognizing the inherent humanity in every individual, regardless of their race, socioeconomic status, or HIV status. We have the tools to end the HIV epidemic. What we need now is the collective will to act. Let us rise to the occasion. Let us be the generation that ends HIV once and for all. Once